our very own nurse practitioner, Kimberly Nieves. She hates it when I call her our women's health specialist at Rockville Internal Medicine Group, because she says that is not her title, but that is the title that I have given her since I started. If you know anything about me, you know that's what I do. But she is very well versed in all things women as well as all things internal medicine and family medicine. So I'm very excited to bring her to our webinar series to talk about something that's actually very important and something that I'm very passionate about, which is knowing your status in sexually transmitted infections. And I just want to give a little blurb before I let her get started about why this is so important to me, is because it's interesting. I'm looking at the number of attendees that we have, and I'm not going to really say, but I will say that our attendance so far is lower than the ones that we've had. But I think that out of all of the webinars that we have had so far, this is one of the most important, because I think this is one of the issues that is constantly overlooked, not only by some providers, and it's not saying bad things about providers, but also by patients. It is important for you to know your status in all realms and forms of sexually transmitted infections, because it does impact your health, and it also impacts the health of others. So while you may be thinking that you are in a monogamous relationship, you never know about the other person. And I'm not trying to say that about people's relationships and, get people in trouble. I'm just being very honest, being very, very honest. The only person's status who the only person's status that you can control is yours. And so having that knowledge is very important. I've taken care of many patients in my, short career that has been going on. And I will say that I have had incidences where patients have thought that, they were in a monogamous relationship and found out they were not. And the way that they found out they were not is because we found out their status. So it is definitely something that I encourage. And so with that, I'm going to turn the floor over to our very own Provider Nieves to give us the skinny on knowing your status. Provider Nieves.
Hi, thank you for that wonderful introduction, Dr. Holmes. So I was happy to speak at this webinar because I agree with you. It's a topic that not many people in general talk about enough and know enough about to make sure that they know their status and to make sure that they know the status of the persons that they're in a relationship with. So it's quite important, and it would be wonderful if at a later time, as word spreads, we'd be able to maybe have this discussion again so more people could be involved. And with that, I will begin, and I will try not to go too slowly or too fast, so forgive me if either occurs. Now, how do I share my screen?
There should be a share button at the bottom.
Mine is not highlighted. Oh, there it is. Got it now. So let's see. Can you see that just okay? All right, excellent. So with that, we'll start our talk on sexually transmitted infections. And you'll see the quote here: life is a sexually transmitted disease and the mortality rate is 100%. And that's Artie Lang is a Scottish psychologist. I thought that was quite a clever bit of information. So we'll start with the characteristics of sexually transmitted infections. What most people don't realize, or at least a lot of people don't realize, is frequently there are no symptoms when someone has a sexually transmitted infection. That is one of the main reasons why it's important to be screened for STIs, as I'll continue to call them going forward. They can lead to significant health complications if left untreated. And what I think the vast majority of people need to know is that there are treatments that exist, and there are a select few of the sexually transmitted infections that do have cures in existence today. The risk factors that could we need to discuss is how is it that you can go about having or contracting a sexually transmitted infection? And these are some of those risk factors. First of all, if you've had a new partner in the last 60 days, that's one reason. You know, during 60 days, there's a lot of information that needs to be learned about another person, a lot of information that needs to be discussed between two people in a relationship. And there may be some missed things during that course of time. You're in the honeymoon phase, so as we say, so that's why that is listed. Sex with someone recently treated for an STI. It could be that they have exhibited behavior that could have put them at risk to have a STI in the first place. So that's why that's also a concern as far as risk factors goes. When there is either no condom use or inconsistent condom use. So I'll ask patients, you know, do you use condoms with sex? And they'll say yes. And then I say, every time? And they say, well, not every time. So it's unfortunate because it is those times that you don't use condoms that you place yourself at risk for contracting an STI. If there's any trading of sex for money or drugs, because there are persons who are addicted to certain illicit drugs, and that can, you know, pose a problem. If they are addicted, they would be willing to trade sex for those drugs or for money. Sex with prostitutes or escorts is a risk factor, and as well as in this day and age with the evolution of, you know, social dating on the internet, many dating sites, meeting anonymous sex partners on the internet poses a risk for contracting an STI, again, if you don't know the person or their status as well as you should or at all. High-risk groups who are more likely to have an STI would include persons age 15 to 24, and that's not because their body is built in such a way that they're more predisposed to getting STIs. It's more because in this age bracket, these persons consider their peers who look otherwise healthy to be absent of any STIs. Oh, they looked fine, or oh, they're extremely attractive and they keep themselves so well, and they speak so well. There's no way they could have an STI. Well, unfortunately, with STIs, it's not on the face, right? It's not something we can see, and that's why screening is so important. MSM means men who have sex with men. They are a high-risk category, and one suspicion is because some men who have sex with men are not as willing to share that information, therefore to go and protect themselves with condoms and so on. So that's a concern, and there should not be any judgment when it comes to protecting yourself, but unfortunately in our society there's still judgment. Any history of sexually transmitted infections makes a person a high risk for contracting a future STI if their behavior has not changed. If you have an HIV positive status, that also puts you at risk for developing or contracting other STIs if you engage, number one, in high risk behavior, absent of condom use, of course, as well. And because HIV can suppress the immune system, therefore putting a person at risk for complications associated with STIs if contracted. And we'll go into further detail about HIV at a future slide. Pregnant women are considered a high-risk group, and that's why pregnant women are screened with each pregnancy. Persons who are imprisoned, whether it be adult prison or juvenile center, they are at high risk for contracting STDs because this population is not supposed to be fornicating or having relations with other inmates. However, it does happen, whether consensual or not, unfortunately. And there are not condoms used or distributed enough to prevent transmission. And lastly, another high-risk group would be those who participate in illicit drug use. You know, for obvious reasons, their judgment is hampered if they're under the influence of illicit drugs. Symptoms that could arise if you contract an STIs, and please keep in mind, not all STIs have symptoms that can warn you that you have something that you need to get checked for. Some of those symptoms would include either vaginal or penile discharge, genital or oral lesions or sores in the genitalia or anus, pelvic or genital pain. And, I'm going to go into great detail about that because I do get quite a few women who come in with severe pelvic pain or intermittent pelvic pain. And one of the things we talk about is screening for sexually transmitted infections as well. And then a foul odor from the genital region could also indicate that there is something underlying going on. Some complications that can arise if you contract a sexually transmitted infection would include an upper genital tract infection. And for that, when we're talking about women, that could include inflammation, or infection of the uterus and or the fallopian tubes. And that in of itself, unfortunately, can lead to some infertility issues because untreated sexually transmitted infections can cause scarring of the reproductive tract. So another complication is infertility, and that falls in line with the scarring of the reproductive tract, which then makes it more difficult for someone to become pregnant at a later time. Chronic pelvic pain, again, going back to the inflammation in the pelvis. Cervical cancer. Cervical cancer is caused by human papillomavirus, and I will be discussing that further as well, but it is sexually transmitted. Fortunately, there are some preventative measures for that besides condoms, but cervical cancer is one of those complications that a person or a woman is at risk for if she contracts the specific high-risk papillomavirus or HPV. And chronic infections can be one of the complications as it relates to HIV or hepatitis viruses. As you can see, there is quite a long list of sexually transmitted infections. Some you may have heard of, others you may not have or have not considered it as a STI, but they are. And I'll go over each of these individually. And just to run through the list really quickly, that chlamydia, gonorrhea, trichomonas, syphilis, HIV or human immunodeficiency virus, hepatitis B, which can be transmitted via blood, semen, or other body fluids that contain blood. Hepatitis C, same mode of transmission as the hepatitis B virus. Human papillomavirus, Mycoplasma genitalium, and herpes simplex virus. We'll start with chlamydia and gonorrhea, and I paired these two together because commonly when we are evaluating someone or testing them for chlamydia or gonorrhea, we'll test for both, and the test usually does come hand in hand, even when we order it. These are the most commonly reported STIs, and when I say commonly reported, not just from a patient perspective of symptoms, but we as healthcare providers have to report STIs to the Department of Health when we get a positive result, because we want to keep track of how prevalent these infections are so that we could continue to research and educate people to minimize further transmission. Curative treatment does exist for these infections, and it involves antibiotics, whether it be oral or injectable. It's just a matter of being tested, knowing your status, and then being treated appropriately. We do find these are highest amongst adolescents and young adults. And again, for the reasons that I mentioned earlier, and you think about adolescents, in most cases, they need a parental permission to go see a pediatrician. If a teenager calls a pediatrician's office to make an appointment, more often than not, they'll be asked to bring a parent or to have some kind of consent from the parent, and that may be a deterrent for adolescents to be screened or checked, and that's why there are some what we call free clinics available in such situations for young adults and adolescents and for the general population in general. Chlamydia and gonorrhea can have an impact to a person's health and their relationships. For women, when we talk about impact to their health, we are again talking about pelvic inflammatory disease, which can come from infections like chlamydia and gonorrhea. Chlamydia more so in the sense because it does not show symptoms early on, and a person could have this infection and not be treated and then subsequently develop inflammation in those reproductive organs that I mentioned. as well as scarring, which could lead to, as you can see, infertility, complications of pregnancy, and chronic pelvic pain, as I've mentioned before. For men, if they are treated, it can reduce the rate of infection to other persons, whether it be to other men or other women. We also can reduce the rate of reinfection because we want to make sure in most cases that when a person or a man is treated, or if a woman is treated, that their partners are simultaneously treated as well, so that we can prevent, again, further transmission. And again, with men, we want to reduce transmission, and that's for with women as well. Fortunately for men, it's not as common for them to have this pelvic inflammatory type of pain that I've alluded to for women, but they can have pain in the penile area. And then it's recommended for persons who have tested positive and been treated to then be retested 3 months after their treatment if we're really trying to hone in on preventing further transmission to new partners or existing partners who've been treated. Next, we'll go into some details about trichomonas. Trichomonas, it's often not displaying any symptoms. And if it is going to display symptoms, they would fall in line with that of bacterial vaginosis. I've seen that before where someone thinks, oh, I think I have BV, again, is how they refer to it. And when I test for bacterial vaginosis, I test for yeast infections as well. And fortunately, the swab also checks for trichomonas. So that's important. Trichomonas can cause complications with pregnancy. As I've said, any of the STIs can do so. There's also a higher incidence of contracting HIV for women who test positive for trichomonas. However, there's a higher incidence of trichomonas in women with HIV. So the question is, which came first, the chicken or the egg? It falls in line with HIV. You have a suppressed immune system. Therefore, if you contract something, it can cause further complications. Your body is not as adept as to fight it off. And then with trichomonas, there is no routine screening recommendation for this specific diagnosis, which we wish that there was. And for persons and providers who are as passionate about screening for STIs, as Dr. Holmes stated initially, it's important and it's helpful so that we don't continue to have such infections be transmitted to other persons. Next, we'll talk about syphilis, and I will have a picture slide for you after this slide, and I'll forewarn you some of the areas of that picture. If you have a weak stomach, just don't look, but I'll warn you again before I proceed. Some of the symptoms with syphilis would include, a painless genital ulcer, and that's with primary syphilis. Person who has not been infected in the past, they may find that there's just this ulcer in the genitalia and they can't understand, okay, where did this come from? It's not hurting me, it's not bleeding, there's nothing from it, but they'll come in, they'll get it evaluated, and we'll see it, and it makes sense that, listen, we need to screen you for an STI. They may present with a more diffuse rash on their trunk, their extremities. They may have some weakness in their arms and legs that they may feel is not related to an STI, but here it is, it can be, as well as some nerve dysfunction, some chronic headaches. So as you can see, there can be some systemic effects when it comes to STIs, including stroke, because again, there are some neurological complications that can arise. It can, as I said, contribute to cardiac and neurologic sequelae. There are minimal symptoms unless you are looking for them or you know what you're looking for. It's hard for someone to say, oh, this is related to a sexually transmitted infection. It is associated with the increased risk of HIV, and testing for this is performed via blood work. This is the slide I was telling you about. You can see the lesions on the hand, the ulcer on the penis, and this faint rash on the trunk or the stomach. With regards to HIV or human immunodeficiency virus. It's a chronic infection. However, treatments do exist. And I used to treat this back in 2004, where it was more of a cocktail treatment. Treatments have come quite a long way. However, there's still no cure for HIV. So our best mode of prevention is using condoms and testing and knowing your partner's status. If it's left untreated, it can lead to morbidity, mortality, and further transmission. And the morbidity, mortality is linked to, again, lack of treatment and how it can affect you systemically. Your immune system is substantially compromised, but therefore it leaves you open and vulnerable to super infections. Symptoms initially present like flu-like symptoms or Epstein-Barr mononucleosis type symptoms with the lymph node enlargement, the fever, sore throat. A lot of these symptoms that you see here are symptoms that we are seeing with COVID. So, we have to be very cognizant of the fact that what is our sexual behavior? Have we been placed at risk? What do we need to be tested for? And have an open discussion with your provider so that we can make the appropriate decision regarding screening for you. The treatment for HIV is antiretrovirals. It's a category of medicine, and it helps to treat and make sure that the virus doesn't become so robust that it compromises a person's overall health. And if treated appropriately, persons infected with HIV don't necessarily progress to AIDS, and they can have a near normal lifespan. It can decrease the risk of transmission, and people with HIV who are treated appropriately can live long, full lives with their partners who are not infected with HIV. So keep that in mind. Next is hepatitis C. Hepatitis C is a virus. It is spread through the blood. It is diagnosed via blood work. It is not routine necessarily blood work with your annual. However, it should be a virus that is screened for in your adult years. And if you're sexually active and if you've had multiple sexual partners, you should be screened for this. It's a chronic infection that if left untreated, unknown, it can lead to liver cirrhosis and in some cases liver cancer. It is recommended, as I said, for all adults to be screened at least once in their lifetime, but more often if you're engaging in high-risk behavior. Every pregnancy, a woman is screened for this. And those persons who were born between 1945 and 1965, classified as the baby boomers, are actually 4-5 times more likely to have hepatitis C virus. Symptoms usually don't present unless the person has advanced disease, and in those situations they may present with a yellowing of the eyes or skin called jaundice, or with their routine blood work we may find elevated liver tests, and in those cases we do check for hepatitis virus. The treatment, over the last decade or more, has been so advanced that most people, and again, it depends on the strain of hepatitis C, can be cured in 8 to 12 weeks. So again, it's all about knowing your status. Next is Mycoplasma genitalium, and that is a bacteria. We don't hear much about this one. It can cause similar symptoms of inflammation of the urethra for men, cervix for women, and it can possibly, again, contribute to pelvic inflammatory disease and prostatitis or inflammation of the prostate for men. Herpes simplex virus is one of the diagnoses or questions I get asked quite often. Can you test me for herpes? So I usually will probe a little bit more and ask, well, why are we testing you for herpes? Is there a concern about a sexually transmitted infection? Because I want to get as much information as possible. I don't want to just blanketly order a test because it may not be enough to just order that one test. And I think that's where the education comes into play. So there are 2 types of herpes simplex virus, and this should not be confused with herpes zoster, which is shingles. Herpes simplex virus is in some cases sexually transmitted. And there are two types. Herpes simplex type 1, more commonly oral herpes or cold sores on the mouth can be linked to herpes simplex virus type 1. And type 2 is more commonly noted in the genitalia and sexually transmitted. Now, you can have either of these present in the opposite location. So you can see herpes simplex type 1 type lesions in the genitalia. It does not only have to be on the mouth. And when we do swab those lesions in the office, the lab will distinguish what we're seeing. Symptoms, usually people don't have any. And 1 in 6 people between the ages of 14 and 49 have genital herpes. So keep that in mind with regard to sexual encounters, because even though you may wear condoms, which is absolutely recommended, transmission can still occur. It can occur through saliva, it can occur through sores or healing sores that may not appear to be concerning at the time, but these may be healing herpetic lesions. And skin-to-skin transmission because the virus lives in the skin. Screening for this, as I mentioned, is not recommended. It is used in specific situations such as new lesions on the mouth or the genitalia. And there is treatment for herpes. However, there is no cure. The treatment is a mode, it's an antiviral that helps to decrease transmission to partners or future partners. And it also helps to prevent or minimize recurrent outbreaks, because some of those outbreaks can be uncomfortable. They can cause a burning sensation. They can feel a little bit raw, especially in the genitalia. Can feel a little bit raw, especially for women when you're urinating. If the urine touches these areas, it can burn the site a little bit, causing some discomfort. And I think I went past one of the ones I wanted to go over. Yeah. So hepatitis B is one of the hepatitis strains that I wanted to talk about. Hepatitis B, if it's left untreated, again, can lead to cirrhosis of the liver, can lead to liver cancer and further transmission of hepatitis B virus. Some of the symptoms of hepatitis B, as you can see, are pretty general: fatigue, poor appetite, stomach pain, nausea. I mean, you can have that with just about any illness. But jaundice is pretty specific to a liver issue. And jaundice would be that yellowing of the eyes and skin that I spoke about before. The outcome with regard to hepatitis B is worse if there's a co-infection or any coexisting liver disease. So when people are being evaluated or diagnosed with hepatitis C, they will be checked or evaluated for hepatitis B and A simultaneously, and will be vaccinated. If they are not positive, they will be vaccinated for hepatitis B and A prior to initiating any treatment of hepatitis C. The treatment for Hep B in the acute phases or the newer diagnoses are mainly supportive, because there are situations that would warrant hospitalization, and that's because of the risk of potential blood clot, or if someone has a pre-existing clotting function concern, if someone is significantly jaundiced. So, I mean, in the hospital, I've seen people who are so yellow, it looks almost like a highlighter, and it's quite disturbing to see because the whites of their eyes are bright yellow, not just a slight yellow, bright yellow. Older patients need to be evaluated and monitored more closely. And if someone has comorbidities, they need to be monitored more closely. And I think in today's pandemic, most people know what comorbidities are. When you have any COPD, hypertension, high cholesterol, obesity or morbid obesity, and in this case, if you have also other STIs like HIV, it should be that someone is monitored a lot more closely. If they're not eating or drinking appropriately, or if they have no social support, because we do still have to acknowledge the fact that not everyone has the social support to be able to be discharged and allowed to follow up as an outpatient. There is vaccination for hepatitis B, fortunately, and most parents are allowed the opportunity to start hepatitis B vaccinations for their children when they're born. So that's a discussion between the person and the pediatrician of the child. And then back to human papillomavirus. That's, again, sexually transmitted. It is a virus and it is viral. There are more than 200 types. So it's a bit daunting to know that that is how many exist. Most of them will resolve in 12 months. However, if they don't resolve and continue for greater than that time, it does increase the chance of precancer or cancerous lesions. You know, when I test a woman during her routine pap smear and it turns out that she's HPV positive, and she's been with a partner for 5 years, 6 years, 7 years, and this is her first HPV positive, but she's had other partners prior. She questions if her current partner is being unfaithful. And I have to reiterate, this is not a test that can tell us when you contracted HPV. It just tests for the presence of it. And it can be detected even 10 years after the sexual encounter or exposure, because the virus can enter into this latent phase where it doesn't cause any changes on testing. So that's how it goes undetected. It can cause cervical cancer, can cause cancer of the mouth and throat, primarily the throat, the anus, and it can also cause warts in the anogenital area. Screening is performed with the pap smear as we've historically known it, or pap screening. And that's when a woman will have her gynecological evaluation. It's not just checking for abnormal cells, but it's also checking, is there the presence of human papillomavirus? Because we need to know what types, which we can kind of narrow down when we send it to the lab. And that will give us some indication as to, are these the high risk types? Because there are some that are more high risk than others. And that tells us how closely these persons need to be followed. Screening of the anus is also done for those who partake in anal sex. Primarily, it's targeted towards men who have sex with men. And there are some infectious disease specialists who do anal screening for HPV or any type of anal cancer. Currently, there are no tests to check for HPV in the oral pharynx. Hopefully that'll come down the pike soon, so that at least we can have a complete screening process. And there is vaccination available for HPV. You may have seen the Gardasil commercials on TV at some point, and this vaccine has the ability to prevent 9 different types of HPV. And you may look at the more than 200 types I mentioned earlier and say 9. Well, that's not a whole lot, but it's the high risk types, you know, and that's the concern. We want to at least try to curb transmission of the high risk types that can contribute to those cancers that I mentioned. The vaccine is available for both males and females starting at age 9 up through age 26, and it is recommended. However, it has been approved for adults 27 to 45 at this point. Just keep in mind, it's not always covered by insurance, so you're going to want to check with your insurance if you don't want to pay for this particular vaccination. And in summary, sorry, trying to. So just to review, STIs are detected in those with or without symptoms. So that's why it's so important for you to screen yourself and require that your partner is screened as well. Share screening results. You want to know, okay, what date was my partner screened and what are we starting with here? Because it's very easy for someone to tell you that they've been screened and to say, you know, everything was negative, but for you to see it yourself is the only way you can really know what those results showed. Condoms always should be used. If you're not in a monogamous relationship, where you know your partner's status. You don't want to infrequently use them. You don't want to use them after you've already started to engage in a sexual encounter and then stop and then place the condom on, because it's not a matter of when you use it. You have to use it for the entire duration of your sexual encounter. Early detection of STIs is crucial, and treatment early on in the viral or disease process is crucial to decrease the long-term impact that it could have to someone's health. Again, there are numerous types which we've reviewed, and at the end of the day, you want to talk to your healthcare provider if there are concerns regarding exposure or inquiries about STIs. Thank you.
Thank you. Thank you so much, Provider Nieves. That was a great presentation. I thoroughly enjoyed it. A lot of good information out there. I want to thank you to our attendees who have been asking questions. So I'm going to jump into the questions. And if you have any questions, again, because I definitely understand that this is a sensitive topic, that a lot of people have, stigmas about and are concerned, please feel free to privately send me your questions. Keep those coming. Or you can also privately send questions to Provider Nieves. She may have gotten some as well. So I'm going to kind of trade off with her with, some of the questions that she may have. So we'll kind of go back and forth. I do have a question that I wanted to ask you. Is kind of talking about when you were talking about transmitting herpes. Do you think you can discuss a little bit the risk when there is no active infection present and the infected person has been on antiviral medication, and then also talk about the risk for in asymptomatic patients with no active infections if they have not been on antiviral medication?
So that's a good question. With regard to a person who has had outbreaks and as far as transmission, and please correct me if I got the question wrong. Someone who has not been on any antivirals, it's more prevalent that it's more of a risk. They will transmit it to another person, skin to skin of the genitalia, or even just sharing a warm kiss on the mouth. You can transmit it in that means. And, it doesn't always have to be this very obvious sore on the mouth or the genitalia. And that's the tricky part, that people don't realize is it'll be a completely healed over area, but the virus lives in the skin of the area where the lesion occurred. So that's how it's transmitted. And if a person is on those preventative medicines to decrease the outbreaks, it's not just to decrease the outbreaks, it's also to decrease the transmission. So if we can do both of those with the antivirals, that would be ideal to help curb this particular virus. Did that address your question?
Yes, that addressed my question. Do you have a question you want to answer, or should I go on?
Let's see. I'm trying to. I do see one here. Forgive me, I'm not as savvy.
It's okay.
Oh, here we go. Can you discuss the risk of transmitting? Okay, and then so I think I touched upon the risk of transmitting. So I'll go to the next question. Cover oral sex is the question. So with regard to oral intercourse, it is, a definite concern. It's still a risk of transmitting an STI, because when you engage in oral intercourse, you're still exposing yourself to body fluids. So keep that in mind. So you're not kind of absolved of any interaction with persons who have sexually transmitted infections. You can develop herpetic lesions on the mouth from oral intercourse, or vice versa. If someone is performing oral intercourse on you, you can still get those lesions in the genitalia. HPV, as I mentioned, which is human papillomavirus, can be transmitted in that means as well. And in these days where people are developing throat cancer, their doctors are actually obviously biopsying those areas because we need to stage those cancers, and it will result, if it is HPV is the cause for that, it will the pathologist will tell the provider that information. So the short answer is, with oral sex, you're still placing yourself at risk. So please still know your partner's status before engaging in any type of intercourse. And that's something that a lot of the younger population also are not aware of, because I've had teenagers who feel very comfortable and they'll ask me, Mrs. Nieves, is it still possible to get something, as they call it, get something, if you, have oral sex with a person, and they don't necessarily put it as gently as that. And I tell them, yes, absolutely. And the eyes are like this when I tell them yes. Like, are you kidding? Like, no, you can absolutely transmit sexually transmitted infections that way.
So one of the questions that I have is in regards to the human papilloma virus, in regards to the, is there a way for a man, or a male, to know that he has HPV? Because men can be silent, quiet little carriers. Is there a way for him to know?
So that is a constant inquiry that I get asked. More commonly, the short answer more commonly is women are the primary people who are screened for this. Men are carriers without knowing their status, and there is no routine HPV test for men. Are there potential tests in general? Yes, there are some infectious disease specialists who have a specific HPV test for men, and they may insert it into the urethral opening to test in that manner. It's not the most pleasant test, but it is a test nonetheless, and you'll know your status. So that's the one way. Other than that, again, it's not widely used, but it is in existence.
Mhm. So another question that I have is talking about the HPV vaccine, and I get this actually a lot in my discussions with my patients in regards to the HPV vaccine. When I bring it up, if they said they haven't been vaccinated, because that initially it was only for, I think it stopped, I think initially at the age of 26. And when the vaccine came out, I was 27. And you know how mad I was about that? You know how bad I was about that? Okay, let me just tell you, I was bad. I was hot. I was like, oh, you come up with this now and I'm too old. Like, what is this? But now the age is actually, if I recall, has been increased to, I think, 40
45.
45. Oh, 45. Oh, gotta brush up on that. So I'm still eligible because that's 42. Yeah. But let's say, is it worthwhile to get it if, for an example, so if you do have a man that got tested and it turned out that he did have HPV, but it was not one of the subtypes that were mentioned in the that are covered in the vaccine, or even for a woman if she had a positive pap and tested positive for HPV, but it wasn't one of the high risk, would it be, or is it worthwhile?
Yeah, I would absolutely have someone seriously consider receiving the vaccination, because it's not recommended if you have already been diagnosed with HPV in those subtypes, because it's not going to cause any treatment. It's not going to get rid of the existing virus. But if we know definitively that you are not testing positive for any of the strains on the panel, it is not harmful. to receive the vaccine in those situations, it's actually could be beneficial if you're still engaging in, dating and potentially exposure to HPV from other partners. It would behoove you to, get vaccinated. Could there still be a latent high risk strain in the body that was not detected? Yes. So again, nothing is absolute. And if you've already started to engage in sexual behavior and then seek out the vaccine, it's in your better interest to get it if you have not been diagnosed with any of those high risk strains. But please understand that it is, again, still possible to have a latent strain that's even high risk in those situations. But you want to err on the side of caution to try to minimize your risks in the future.
So another question that I have, which is one that I'm glad that we have a few minutes to discuss, is about PrEP therapy for HIV, prophylactic PrEP therapy. Do you mind sharing like some of your, I would guess, clinical practice guidelines or things that you use in regards to like your PrEP therapy? How does that work for you?
So when a person shares with me and after a conversation, they share that they are still dating and they may be engaging in some high risk sexual behavior. Number one, we talk about screening as I spoke about, and screening quite often every 3 months. But I then also speak with them about PrEP therapy. And what that is a means of preventing a person from contracting, or at least decreasing the risk of contracting HIV, human immunodeficiency virus. And there are a couple on the market currently. Descovy and Truvada offer PrEP therapy, and it's a 1 pill type of deal, which, if you are used to taking vitamins, it should be pretty easy to take PrEP therapy, right? And you want to be a person, if you're going to engage in such behavior, you want to also be smart about how you take care of yourself. And that's one of the ways. And that's how I pose it to people. Have you heard of, I ask them, have you heard of PrEP therapy? In most cases, people have heard of it. And then I talk to them about the medication, and I talk to them about potential side effects associated with the medication. And when people tend to be a little resistant with any medication when it comes to side effects, I tell them, well, any medication, even some vitamins have side effects, but you have to weigh risk versus benefits. And if the benefit is going to be your general health and well-being in the long term, then that's something that requires some serious consideration.
That's good. It's hard for me. I know, like, I am talking to patients about, PrEP therapy. Like, I like the way that you explained it. That I'm gonna have to steal some of that and use that. Just, because, huh?
Go ahead.
I was saying, just because we have a little bit more time, this is a question that I've just been wanting to ask you, just in general. It's about.
And I have one question on my end too. So.
Oh, you do? Oh, go with your question that you have on your end.
Okay, so it says, should someone 80 years with no symptoms be tested? So that's a very good question, because I don't want anyone to think for 1 minute that elderly persons are not sexually active and are not at risk. That is not the situation. Everyone who is sexually active and may have multiple partners, or may be engaged with may have sex with one person but are unsure of their partner's status, should be screened. That includes 70-year-olds, 80-year-olds, because there are 90-year-olds driving, look great. They look 20 years younger, and they're dating, and they will introduce their girlfriend to me or their boyfriend to me. So these persons should still be screened, because we do find in certain retirement villages that STDs are rampant, because there's the false sense of security that my peers in my age group do not have STDs. We don't do those things, but you don't know what your peers are doing. And sometimes your peers are kind of branching out to other people that are not your peers. And those persons have STIs that they're bringing back to, the village, I guess. So that's something to strongly consider if you are a sexually active person.
I am so glad that that was your question, because that was something that I wanted to ask you, because, coming from my background of doing my geriatric fellowship at Virginia Commonwealth University, that was kind of one of those things that was just so interesting in dealing with intimacy and sexual activity in the elderly community and in the elderly population. Because, as I think, as kids, like I'm somebody's kid, we don't really think of our parents, as intimate beings. And then, for sure, don't think of our grandparents, as like intimate beings, forgetting how we got here, that kind of thing.
Exactly.
And so I always get encouraged, when I'm doing like my social history, when I, ask about intimacy, and especially it's always cute when I have like a mom or a dad and their child is translating for them. And I
Yes.
prep the child in advance. Okay, since you're translating, I'm going to be asking some very like sensitive questions. You're going to have to steel yourself and like, let's ask this question and ask it the correct way, kind of thing. And when I ask the question, the look that like goes over the child's face is like, I don't want to know this. I want to like leave, and then asking and then like the response from the patients is just priceless. But when I was in fellowship, that was kind of one of those things that was interesting to me, because, I would, work at, certain assisted living facilities and in certain community, retirement community settings. And nobody would talk about it. But, like they would come in and I need to get tested. Like,
Yeah.
why are we whispering? It's just you and me in the room. Like, why are we whispering? And, and then having these discussions, with, for most of it, unfortunately it was, my female patients, having these discussions, they were like, I just thought I only had to worry about pregnancy. And like, nope, nope. There's still, there's more stuff out there that and having those discussions and things like that. And I just remember them being very appreciative. So I was wondering, from your standpoint of view, how do you counsel your older patients in regards to getting tested, especially like my older patients, who have, they're widowed or they're divorced, and they're entering into a new relationship, and when I'm blessed that they open themselves up to me and share that, it's always kind of one of those things where I'm like, okay, how am I going to approach this without, like scaring them.
Right. No, I definitely, I hear what you're saying, and it can be a touchy topic for some, because I'll ask, are you sexually active? Yes. Do you use condoms? Oh, no, it's just him and I. How long has it been just you and him, or you and her, and have you both been tested? And the answer is not unequivocally, yes, that we've been tested. So it's important to pose that question and make sure that it's more of a just since as common a question as, are you having any nausea or vomiting? Because if you make it a big deal, then the person is less likely to share information with you. So that's what I try to relay to patients as best as I can. And not everyone can communicate medical terms, and I don't expect them to. I say, you're not going to embarrass me. Just say what you need to say to me and ask me what you need to ask in the way that you know how to ask it. It doesn't matter what it is right now, because I just need to know what you're asking, and then we can go from there. Don't worry about how it comes out.
That's awesome. Well, I appreciate everyone that attended, and for those who are not attending, I'm hoping that I'll be able to get the recording of this. And so I'm going to send this message for those of you that did not attend, but are watching this via, I don't know if we're posting this on YouTube or whatever vehicle you're watching this from. If you have any questions, please feel free and be encouraged to discuss those with your provider. If you don't feel comfortable talking to your provider, I think in our practice, we are always very open to wanting you to get the care that you need. So go see provider Nieves. She is very well versed in this, and it's a non-judgmental zone, as far as when you come to the doctor's office, because our primary objective and our primary goal is to take the best care of you that we can. And if you don't share with us and talk with us and be honest with us, we can't do that. You're crippling us. So be honest, because we just want to help you. That is it. So if you don't feel comfortable talking to your provider, schedule an appointment with provider Nieves. She'll be willing to answer all your questions and take care of everything. And she will pop you right back to your PCP.
Yes, I will.
And if, for some reason she's not there because she's, out on one of her mini vacations, I'm just kidding. Feel free to schedule with myself. Because again, this is definitely something that I am passionate about. I'm passionate about a lot of things, but we are here for you. And so thank you.
I just want to add one thing. And also, if I do get a lot of questions from parents for their children. So keep that in mind, because not all parents are comfortable talking to their child's pediatrician about sexual health. So those are questions that we welcome as well, so that you could then educate your children or your nieces or nephews about this information, because that's important. They're the next generation, and we want them to be quite knowledgeable.
That is awesome. That is so true. That gives me an idea. We need to talk offline about kids. So yes, so join us again for our next webinar. I have, surprisingly, in May, 3 lined up, 3, very excited. One is for, I think it's like National Skin or National Healthy Skin Awareness Month. So we will be having our very own dermatologist, Dr. Brooks, talking to us about skin care and protecting your skin in the summer months. And then May is also Mental Health Awareness Month, and we have 2 wonderful presentations by our very own Dr. Moskowitz, who is one of our behavioral specialists, one of our behavioral therapists, and she will be talking about mental health. I'm not going to tell you what it is. You have to come in and find out, because I'm very excited about all 3 of these. I've been working hard with this, getting coordinated, and I'm so excited about May. So stick around for May, you guys, and have a great weekend. Bye.
Bye.